respiratory system can be divided into the upper and lower respiratory systems. The upper respiratory system consists of the nose, the nasal cavity, sinuses, pharynx, portion of the larynx above the vocal cords. The lower respiratory system consists of portion of the larynx including vocal cords and below the trachea, the bronchi, the bronchioles, the alveoli, and the lungs. Here's a 3D model where I will be pointing out some of the items that I am talking about. First, I want to talk about the sinuses. Here I want to point out the frontal sinuses. We have the right frontal sinus and the left frontal sinus. Then we have maxillary sinuses. Here is the right maxillary sinus and the left maxillary sinus. Next, I want to talk about the pharynx, which is a correct medical term for the throat. The pharynx is partially shared passageway for the respiratory and digestive systems, beginning at the posterior nasal cavity and extending to the trachea. The upper portion of the pharynx is the nasopharynx. Then inferior to the nasopharynx is the oropharynx. And then the most inferior part of the pharynx is the laryngopharynx. Next, I want to talk about the larynx. It consists of 9 cartilages that are interconnected with muscles and ligaments. The largest of the cartilages is the thyroid cartilage, which is most known for the Adam's apple. Inferior to the thyroid cartilage is the cricoid cartilage, right below there. Then I want to talk about the epiglottis. The epiglottis is an elastic cartilage flap that closes during swallowing to keep substance from moving into the trachea and air passages. The larynx also contains the vocal cords. So now we get down to the lower respiratory system. First, I want to point out the trachea. Air travels from the larynx to the trachea. The trachea is a tubular structure consisting of dense connective tissue and C-shaped rings of hyaline cartilage. The inferior end of the trachea divides into right and left bronchi at an area known as the carina. This is the last tracheal cartilage. Here we have the right main bronchus and the left main bronchus. The bronchi continue to extend. Here I will fade out so you can see. And we will zoom in a little bit. So the bronchi continue to branch and form small bronchioles that divide to form terminal bronchioles, which mark the end of the air conduction pathway. Gas exchange begins at the respiratory bronchioles, which connect to the alveolar ducts. The alveolar ducts give rise to the alveoli here at the ends. The alveoli are considered the functional unit of the lungs and consist of small hollow areas for gas exchange. Lungs contain about 300 million alveoli. Then finally, we are going to talk about the lungs. The lungs are 2 cone-shaped structures residing in the thoracic cavity that are soft, pliable, and sponge-like in nature. First, I'm going to point out the right lung. The right lung contains 3 lobes: the superior lobe, the middle lobe, and the inferior lobe. So the right lung is larger than the left lung because it holds space for the heart. So the left lung contains the inferior lobe and the superior lobe. And it also contains the cardiac notch here, which is an indentation for the heart. The apex of the lung is located where the upper lobe begins, here at the very top on both sides. The very top there. Then the costophrenic angles are located at the lower outer edges of the lungs, right about here. finally, below the lungs is, in this area, the diaphragm.